My name is James Allison. I'm a dentist and researcher at the School of Dental Sciences at Newcastle University. Let me tell you a little about the work we've been doing in Newcastle looking at dental aerosols. Aerosols in dentistry have become something of an issue since the COVID-19 pandemic. This is because the tiny water droplets from dental instruments, like the handpiece you see here, can pick up potential pathogens from saliva in the mouth and carry them into the air during dental procedures. Many people have seen this as a problem since the protective equipment we normally wore before the pandemic would not necessarily protect against these aerosols. As a result, many dentists have been wearing more robust protective equipment during the pandemic, but this is expensive and difficult to work in. Additionally, the potential for transmission of COVID-19 during the pandemic meant that patient numbers had to reduce, and in many countries it was recommended that dental offices or surgeries were left empty between patients to allow aerosols to disperse. In all, this had a massive impact on dentists being able to offer care to their patients. We decided to look at this problem using a fluorescent tracer called fluorescent, which is widely used as a tracer in environmental research, and we used this to allow us to see where these dental aerosols went. We developed a number of methods to capture this fluorescent tracer, including settling out of filter papers in the environment and capturing aerosols using air sampling equipment. We put the fluorescent tracer into the irrigation reservoirs of the instruments we used to see where any of these water droplets went. And separately, we used it to model saliva to see where the saliva might be carried to. This allowed us to see in great detail for the first time where these aerosols were distributed to during dental procedures. We also looked at several measures to control these aerosols, including alternative drill designs, dental suction, and local exhaust ventilation. And this is a powerful device that captures aerosols close to the patient's mouth, and you can see on the right here. Just to very quickly look at one specific example, we used an air sampling technique to capture aerosols at 3 different distances from a dental procedure with an air turbine handpiece, which showed high production of aerosols even at 1.7 meters away. However, when we used a different design of drill that doesn't force water out using compressed air and tested this at different speeds, we found that the aerosols were not detectable even very close to the procedure. Across all the studies we've carried out, we found that the water spray from drills can travel large distances, but this is mostly water and very little saliva, that much of this is affected by the design of handpiece used, and also that suction and local exhaust ventilation were highly effective in reducing the aerosols produced. This work's been very impactful and it's fed into national guidance documents in the UK, as well as informing measures in other institutions internationally. It's allowed us to reopen our clinical services and teaching locally at Newcastle. Going forward, we aim for our continuing work, which is now using even more detailed methods to feed into future preparedness for infectious disease outbreaks like what we have seen during the COVID-19 pandemic. This has been a huge team effort from a number of individuals and wouldn't have been possible without our funders. Thanks very much for listening.